One of the most common questions that I'm asked when I had a role as a neuro-rehabilitation specialist was, does my child need surgery? And I have a slightly different view about surgery. Parents frequently say, no surgery, no Botox, no spasticity medications. My child is not going to be raised with all those nasty interventions. And while I can respect where they're coming from, I think we have to understand better the effect of biomechanical distortion. If a child has got an early nerve or brain damage, they're recovering in a growing body. And if you don't put splints on, if you don't put braces on, if you don't use the spasticity medications that we now fortunately have, if it's severe enough, then you're going to end up with a child with a distorted body. Surgery for kids, for some kids, is really necessary. Other kids can get away from it, and part of it, in the book that I'm writing, I try and explain to people that you can almost predict it. So for example, I'm very tall, I'm heavily muscled, I grew very quickly, and if I had really mild to moderate CP, I would have needed surgery because heavy muscled, big, rapidly growing. But if I was a tiny little petite woman, little girl, who went through puberty later, who grew slowly, with little bones and light muscles, with exactly the same amount of neurologic problem, that child could probably be managed with less invasive techniques. So that as parents become more educated about what the risk factors are for the need of surgery, I think that it'll be easier for them to understand.